Okay, let's dive in. You've brought us a stack of sources, articles, research, guides, all focused on something pretty serious and, frankly, a bit alarming.
Uh-huh.
We're going to unpack it all to get to the absolute core of what's important. Today, we're talking about a specific, potent type of rodenticide poisoning, bromethalin toxicosis.
That's right.
It's different from the old school rat poisons you might think of, and it seems to be showing up more often.
Yeah, the sources really point to that rising prevalence.
What makes it uniquely dangerous is that it doesn't mess with blood clotting. It goes straight for the brain and nervous system.
It's exactly what these sources highlight. They give us a clear mission to guide you through understanding what bromethalin is, why it's so uniquely dangerous, the critical signs you need to watch out for, how incredibly tricky it is to diagnose, what treatment looks like, spoiler, there's no antidote, and most importantly, how to prevent exposure in the first place.
Right.
Our goal is to give you a clear, comprehensive picture of this specific threat without getting lost in, overwhelming technical detail.
And that point about it attacking the brain directly is key. This isn't just a general poison. It targets the central nervous system, causing brain swelling, and the effects can be dangerously delayed.
Exactly.
So let's get into the mechanism. What exactly is bromethalin, and what does it do once a pet ingests it?
Well, what's really fascinating and terrifying here is how it works. Bromethalin, and particularly a substance your body makes from it called desmethylbromethalin,
Okay.
it acts like a saboteur in your brain cells. It disrupts their ability to create energy.
Energy, like literal cellular power.
Exactly. Think of the cell's mitochondria as its power plants, creating ATP, the energy currency.
Right.
Bromethalin essentially shuts down this power plant process. The technical term is uncoupling oxidative phosphorylation.
Okay, so the power is off. What happens then?
Without energy, the cell's critical pumps, like the ones that maintain a healthy balance of salts and water across the cell membrane, well, they stop working.
Ah.
Specifically, the sodium-potassium pump fails. When that pump fails, sodium starts building up inside the cell.
Right, and water always follows sodium.
Precisely. So you get water rushing into the cells, causing them to swell up.
Oh, wow.
This swelling is called cytotoxic edema, literally, cell swelling caused by a toxin. In the brain and spinal cord, this causes spongy changes or vacuolization, damaging the tissue.
Okay.
This swelling increases pressure inside the skull, intracranial pressure, which directly impairs nerve function, leading to the neurological signs we see.
And you mentioned that metabolite.
Yes, desmethylbromethalin.
Yeah.
It's even more potent than the original compound, making the problem worse as the body processes it.
Wow. So it's not just the toxin itself, but what your body turns it into. That's the biggest threat. And it literally makes the brain swell by shutting down cellular power. That sounds incredibly damaging.
It is.
And the sources are really clear that cats are drastically more sensitive than dogs, even at much lower doses.
That's a critical distinction you absolutely need to remember. The sources cite toxic doses for cats around, like 0.3 milligrams per kilogram of body weight.
Just 0.3.
Yeah, whereas for dogs, it's closer to 2.5 milligram kilograms. The amount lethal to half of tested animals, the LD50, is 0.54 milligram kilograms for cats, compared to 3.7 milligram kilograms for dogs.
So a tiny amount, perhaps just a crumb of bait, could be devastating for a cat.
Absolutely. While a dog would need to eat significantly more relative to their size.
Okay, given that mechanism and sensitivity difference, how quickly do you see signs and what do they actually look like? Because the sources make a big deal about this delayed onset, which is pretty alarming.
Yeah, this raises an important question about timing, and it's one of the trickiest things about bromethalin.
Yeah.
Unlike some poisons where signs are immediate,
Right.
bromethalin can have a significant delay. In dogs who've ingested a very large dose, you might see acute signs like tremors and seizures within a few hours to maybe a day.
Okay, the high dose ones.
But with lower doses in dogs, and typically any dose in cats, you see a delayed syndrome. This can show up anywhere from 2 to 7 days after ingestion.
Days later.
Yes, and the sources even mentioned it can be delayed up to 2 full weeks.
2 weeks. That's terrifying from a prevention and diagnosis standpoint. You might not even remember something they ate that long ago.
Exactly. It makes it incredibly insidious. In dogs, depending on the dose, you might see that acute convulsant syndrome, severe tremors, muscle rigidity, they might be jumpy to sounds or light, potentially progressing to seizures, coma, and sadly, death. But with lower doses in dogs, and what is most common in cats, you see the delayed paralytic syndrome.
And describe that for us. What does that look like day to day?
Well, it often starts subtly. Maybe they're just a bit more tired than usual or not finishing their food, vague stuff.
Okay.
Then you see progressive weakness, often starting in the back legs. They might stumble or be uncoordinated. That's called ataxia.
Stumbling, okay.
This weakness can progress to full paralysis. You might also notice fine muscle tremors, changes in how aware they are, altered mentation, or even strange eye movements, like nystagmus, where the eyes flicker back and forth.
Wow.
Cats also commonly show the decreased energy, not eating, maybe vomiting, and the hind limb weakness escalating to paralysis. They might also have issues with their digestive system slowing down, decreased gut motility, or difficulty urinating.
So it ranges from vague tiredness and hind limb weakness to full-blown paralysis or seizures, and it can show up anywhere from hours to 2 weeks later.
Exactly.
That has to make diagnosis incredibly difficult. There's no simple test you can just run.
This is where the challenge truly lies. You're right. There's no quick, simple, readily available blood test that screams bromethalin.
Nothing easy.
No. The diagnosis relies heavily on detective work.
So the history is absolutely crucial.
It is paramount. You have to have strong suspicion based on potential exposure.
Yeah.
Was any rodenticide used? In your house, your yard, maybe a neighbor's? If possible, bringing the packaging is absolutely vital because knowing the exact active ingredient tells the vet which poison they might be dealing with.
Okay, so keep the box if you can.
Definitely.
Yeah.
Without a known history of potential exposure, diagnosing bromethalin becomes much harder and often involves vets ruling out a whole list of other neurological problems, other toxins, infections, injuries, even things like brain tumors.
What about imaging, like MRIs or blood work? Do they help?
Well, routine blood work is usually normal, which helps rule out other things but doesn't point to bromethalin.
Doesn't help much then.
Not directly. Imaging like an MRI can show that generalized brain swelling and the spongy changes we talked about. But those findings aren't unique to bromethalin. They can be seen with other conditions too.
Not specific enough.
Exactly. Definitive diagnosis typically requires specialized lab tests to find the actual bromethalin or its metabolite in body tissues like fat, liver, or brain.
Which sounds like something done after.
Often, yes, done after the animal has passed away, though some specialized labs can test samples from living animals, but it takes time and isn't always an option.
Okay.
The key takeaway for diagnosis: forget a quick blood test. It's all about connecting subtle or obvious neurological signs with any potential exposure history, no matter how long ago, and ruling out other causes.
So you're piecing it together from history, signs, and ruling out everything else. Given how difficult diagnosis is, what's the treatment like? Is there an antidote?
This is another critical point from the sources, and a difficult one to hear. There is no antidote for bromethalin toxicosis.
None at all.
None. Treatment is purely supportive. It focuses entirely on aggressive decontamination if the ingestion was very recent,
Okay.
and then managing the severe neurological effects and brain swelling if signs have already started.
Right.
The key insight here is, once the toxin is in and causing signs, there's no magic bullet to reverse it. You can only support the body while hoping it recovers.
No antidote. That really emphasizes the importance of, well, everything we've talked about so far. Prevention, catching it early.
It truly highlights why prevention and early action are the only things that offer a good prognosis. If a pet ingested it recently, ideally within 1 to maybe 8 hours before any signs appear, the focus is on getting it out of their system.
Right. Decontamination.
This means inducing vomiting if it's safe and the pet is alert. After vomiting, or if vomiting isn't an option, administering activated charcoal.
Activated charcoal to bind the toxin in the gut.
Exactly. It's like a sponge. And because bromethalin and its metabolite hang around in the body for a while and can recirculate.
Oh, really?
Yeah, so repeated doses of activated charcoal are often recommended maybe every 6 to 8 hours for a day or two to try and catch anything still in the gut or that has recirculated from the liver.
Keep mopping it up.
Right. You might also give a cathartic with the first dose of charcoal. That's something that helps speed things through the digestive tract, but usually not with later doses to avoid dehydration.
Okay. Aggressive decontamination before signs, if possible. What if signs have already started?
Once those neurological signs appear, treatment shifts dramatically to managing the symptoms and trying to counteract the brain swelling.
Okay.
This involves intravenous fluids, using specific types of fluids that won't worsen swelling. Medications called diuretics are used, like mannitol or furosemide, to help draw excess water out of the body, particularly from the brain, to try and reduce that dangerous pressure.
Trying to shrink the swelling.
Exactly. For tremors or seizures, anticonvulsant medications like diazepam or phenobarbital are essential to control that activity.
It makes sense.
And then extensive supportive care, keeping weak or paralyzed animals comfortable, preventing pressure sores, helping them urinate, potentially feeding them if they can't eat on their own.
A lot of nursing care.
A huge amount. The sources also mention IV lipid emulsion as a possible adjunctive therapy in severe cases, though it's not proven cure. More like a might help situation.
And corticosteroids. Are they used for the brain swelling like they sometimes are for other issues?
That's a good question. The sources note that corticosteroids are actually controversial in bromethalin cases. While sometimes used for brain swelling caused by other things, their effectiveness here is debated, and some sources suggest they might not be beneficial and could even be harmful.
So, not a standard treatment here.
Not the go-to, no. Not like in some other brain conditions.
Given that treatment is so difficult and there's no antidote, what does that mean for the prognosis once signs of poisoning appear?
Well, the prognosis is guarded to poor once moderate to severe neurological signs develop.
Guarded to poor. Okay.
Animals that survive often require intensive care for days or even weeks, and unfortunately, permanent neurological deficits, ongoing weakness, coordination issues, etc., are possible even after recovery.
So they might not get back to normal?
It's a real risk. The only time the prognosis is considered good is if you catch it early, before any signs appear, and perform aggressive decontamination.
Timing is everything.
Absolutely critical. For cats, because of their higher sensitivity, the prognosis is generally poorer than for dogs once clinical signs become apparent.
So, if treating it once signs appear is so challenging and the outcome is uncertain, the single most effective strategy has to be prevention, right?
Absolutely. Prevention is paramount. These sources strongly emphasize avoiding the use of bromethalin rodenticides near pets altogether.
Just don't have them around if you have pets.
That's the ideal. If they must be used, they need to be stored securely, and the baits placed in sturdy, tamper-resistant bait stations that prevent access by non-target animals like your dog or cat.
And being vigilant about supervising pets and educating others.
Yes, crucial. Supervise your pets, especially outside. Be mindful of areas where rodenticides might be used, like garages, basements, or neighbors' properties. Discourage pets, particularly cats, from hunting rodents, as secondary poisoning, eating a poisoned mouse, is a theoretical risk, especially given how potent the toxin is.
Right, eating the poisoned mouse.
And educating friends, family, and neighbors is incredibly important. Not all rat poison is the same.
That's a key point.
Knowing that some target the brain and have no antidote, and that identifying the specific active ingredient is vital for potential treatment, could make a huge difference in an emergency.
This deep dive has really underlined how serious and sneaky this particular toxin is, especially with that potential for delayed signs up to 2 weeks later.
It really is. And that brings us to perhaps the most critical take-home message from all the sources we've explored. If you even suspect your pet has ingested any rodenticide, do not wait.
Don't wait.
Contact a veterinarian or an animal poison control center immediately. Don't try to wait and see because of the delayed onset. By the time you see signs, the damage may be significant and the prognosis much worse.
Okay.
Having the product packaging or knowing the exact name of the bait is incredibly helpful information for them. Early aggressive action before symptoms start is your pet's absolute best chance.
That's a powerful and essential call to action. Know the product and call immediately if there's any suspicion.
Exactly.
Considering how potent and insidious this toxin is, how difficult it is to treat once signs appear, and how easily available these products can be, this deep dive raises an important question for you, the listener. What does knowing the hidden dangers of common household products like this mean for how you approach safety and vigilance in your own home environment, and perhaps even your neighborhood?